Good afternoon, everyone. We had a lovely session on social media just now. Thank you so much to the panelists for that. We are going to have another session on creating mentally healthy work-life culture, workplace culture, sorry. So it's a wonderful topic. It's so relevant as the organizations worldwide have recognized it not as a personal difficulty, but a business priority, you know. And we have lovely panelists with us today, Dr. Anjali, Richa, Dr. Mahanta, Dr. Singh, Dr. Chetna, and Dr. Chinmay. I would request you to tell us more about yourself, please.
I'm a psychiatrist practicing for 30 years, working in different areas related to psychiatry. And of course, when I started psychiatry, people thought that everybody who works with mental health starts showing symptoms in a few years. So people actually came and told my parents कि please उसको psychiatry मत करने दो, वो पागल हो जाएगी. So here I am in front of you, trying to explore each area of psychiatry.
Hi, my name is Richa. My pronouns are she, they, and I'm a psychologist. And it's very interesting to be here because Dr. Shiba was my professor during masters. So it's a very interesting panel for me for sure. I work in the areas of gender diversity, sexuality, and neurodiversity. And I'm a queer person myself, so working for queer rights has been very important to me. So that's something I would talk about with intersections of workspaces. I am the founder of a company called Leher Mental Health. Thank you.
And I must tell everyone, I'm so proud to share the stage with her.
Hello everybody, I'm Dr. Dimpy Mahanta. I'm an educator with roughly 20 years of experience. I was teaching earlier in Delhi University as a permanent faculty for roughly 10 years prior to moving to Guwahati to start the psychology department in Guwahati, Cotton University. So it's been 20 years that I'm in this educational sector. And besides that, I'm a trainer as well. I am associated with organizations like Northeastern Police Academy, Meghalaya Police Academy, Assam Administrative Staff College, Narcotics Control Bureau. And I have my own organization called Northeast Indian Association of Applied Psychology. And through that organization, I'm trying to break the mental stigma and create mental health awareness in my side of the country, that is northeastern part of the country. I'm very happy to be here amongst this esteemed group of panelists. Thank you.
Good evening, everyone. I'm Dr. Archana Singh. I'm a psychiatrist, and I run in two institutes. One is Divyansh Neuro and Manoh Institute of Mental Health and Behavioral Sciences. Also, I work with many corporate houses and banking sectors and dealing with their challenges day in, day out. Being very happy and looking forward for this panel discussion because this is the work I'm doing in my part of world. I'm from Bihar, Patna, practicing over there. Thank you.
Hi everyone, my name is Chetna. I'm a faculty at the Tata Institute of Social Sciences. My training is in clinical psychology. I started as a psychotherapist, worked in supporting some EAPs very early on in my career, but now I teach and do research and work in programs and policies. Lovely to be here and be part of this panel.
Hello everyone. I'm Dr. Chinmay Deshpande. I'm a consultant psychiatrist. I'm founder director of Euthymia Psychological Wellness Center in Pune. I'm also an assistant professor in a medical college and have been associated with teaching MD and MBBS students since the last 6.5 years. Thank you.
Thank you so much, panelists. A quick note about myself. I'm Dr. Shiba Singh, and I run my own mental health studio called Talkspace at Hiranandani Powai, Mumbai. This topic is very close to my heart as I have employee assistance programs. I run those, and I work very closely with corporates and look at their mental health conditions and teach them or maybe tell them to deal with their difficulties. So I'm happy to be there with all the lovely panelists, and we'll be discussing something about what are the conditions at workplace regarding mental health, and what can we do about it, you know. These 45 minutes we'll be talking more about solutions rather than difficulties, so that people learn from that and maybe use them in their workplaces, and we'll be doing some activities also. Yes. So we start our discussion. Yeah. So, yes. So Dr. Anjali, I would like to ask you, what are the difficulties? We'll spend very little time on what are the difficulties, and then we'll go on to the solutions, right? So what are the difficulties, and what are the physical aspects of those difficulties which people face at workplaces?
So first of all, mental health was not thought to be relevant to health at all. So when somebody was having a bad day, someone was not turning up because of mental illness, people did not recognize it. The stigma against mental health is still present, and it can have a lot of impact when someone does not realize that you're sick and you cannot come to work. If I have a fracture of my leg today, I'll get all the sympathy, I'll get recommendations which doctor to go to. But if I have a fracture of my brain, people look at me and says, oh, natak kar rahi hai. She doesn't want to work. He is lazy. These are the challenges that we have to collectively face and fight together.
Yes, perfectly fine. I think most people, most of them till now, they don't recognize mental health illnesses. They still think that if you're physically unwell, you may stay at home, but if you're mentally, अरे घबराहट ही तो हो रही है, क्या फर्क पड़ता है, हम बात करेंगे ठीक हो जाएगा, you know. Doesn't happen like that. So yes, Dr. Archana, please.
Yeah.
I'm asking the physical aspects to our psychiatrists because we would get to know what are the physical impacts of the mental health difficulties.
In any workplace or work environment, the mental health challenges which go missing or which are very silent are usually stress, depression and anxiety. These three are major challenges which employees usually face, employer, maybe both. It impacts our physical health tremendously. Let me tell you by narrating a fact that the Sustainable Development Goals by United Nations, they had developed for 2030, they had said that to reduce the mortality from non-communicable disorders to 1/3, we need to put more efforts on mental health. So mental health not only disrupts your daily activities of living, but it also have the seeds which can later turn into many non-communicable diseases like maybe diabetes, hypertension, CADs and other factors. Because this continuous stress and anxiety, it changes the internal homeostasis, the HPA axis, which probably we all are knowing, the cortisol levels are usually very high. And because of that, a lot of the imbalance happens, and then the mental illnesses usually have a lot of physical symptoms associated with it. And in terms of morbidity and mortality, the persons who are suffering from mental illness from long time, the chronic ones, they have one premature death by maybe 20 years. So with this fact, you can understand the impact of our mental health on our physical body and physical health as well.
Correct. So perfect. Yes. So let's ask about the psychological impacts of mental. Yes, please, yes.
So basically, we don't have any diagnostic tests for mental illness. जैसे कि कोई बुखार है, ये है, तो हम ब्लड टेस्ट रख सकते हैं कि भाई हाँ ये बुखार है, ये बीपी है, ये शुगर है. तो वैसे अगर डिप्रेसिव डिसऑर्डर है या फिर एंजाइटी डिसऑर्डर है, तो हम क्लिनिकल इंटरव्यू से ही डायग्नोस करते हैं. कोई उसका टेस्ट नहीं है कि नींद अच्छी नहीं तो उसका कोई टेस्ट नहीं है. ऑफ कोर्स मतलब स्लीप स्टडी कर सकते हैं, बट nobody goes in for a sleep study just because person has a disturbed sleep. So और फिर डिप्रेस्ड मूड, डिप्रेस्ड थॉट्स, सुसाइडल थॉट्स, ये कोई डॉक्यूमेंट करके वी डोंट हैव एनी, वी कांट माइंड रीड बेसिकली. साइकेट्रिस्ट, साइकोलॉजिस्ट, वी कांट माइंड रीड. दैट इज अ मतलब कॉमन मिसकंसेप्शन कि आप लोगों का दिमाग पढ़ सकते हो क्या, ऐसा नहीं है.
So Dr. Deshpande, there's a lot of say stigma attached to it, and that's stigma is because of lack of knowledge.
तो स्टिग्मा इसलिए है क्योंकि पहले ये सब डिप्रेशन, एंजाइटी ऐसा वेल नोन था ही नहीं. साइकेट्री मतलब कि पागल, मतलब जो रोड पे घूमते थे पहले, मतलब हमारे एक जनरेशन पहले. डिप्रेशन, एंजाइटी के लिए कोई ट्रीट करता ही नहीं था. अगर वो इरिटेबल डिप्रेशन या फिर हमारे साइकेट्रिक टर्मिनोलॉजी में एजिटेटेड डिप्रेशन हम बोलते हैं, तो उसमें वो
there is another term now, which is like we are weak, that's why we are mentally sick. You know, when patients come to my clinic and they say, I don't know why I'm so weak. And I tell them, you are already strong because you have entered a psychology clinic. You know, it's a sign of strength when you enter and go and tell somebody about your difficulties. That's the strength. And
नहीं,
it's
देखिए,
not
normal sadness is not depression. Normal sadness is
That's
normal
right.
sadness. Depression should not be confused for normal sadness. Normal sadness क्या है, 2-3 घंटे में ठीक हो जाता है.
correct.
Depression is lasts for prolonged periods, days, weeks, months, without any precipitating factor. मतलब without any है.
And depression can cause absenteeism in work.
Yeah, absenteeism or work, family, social,
Correct.
social or sexual dysfunction.
That's what I
उधर तक
said.
जा
It's
सकता है.
not a personal difficulty. It's a business priority these days, a critical business priority these days, because there's absenteeism, there's lack of productivity. A lot of people are suffering because of, say, difficulties at workplace or difficulties at home, but they are suffering, you know.
Absolutely.
That's right. That's right. That's right.
I would like to just add on to what he has said.
Yeah.
In fact, when you ask nowadays little kids also, my daughter, she's 13, you know, she says, Mama, I'm feeling depressed. So basically, the little ones, they don't know, as you rightly said, what exactly is depression. Life is all about sadness and happy moments, and it's very normal to feel, sad at times. But when does depression happens? When the symptoms of worthlessness, hopelessness, meaninglessness stay for like 2 weeks to 6 months and more. So that's the condition. So that lack of awareness that you were saying, I completely agree with you that there is a general lack of awareness in the organizations, because of which the employees don't approach their bosses, or they don't speak about mental health. Second is stigma, as one of you have pointed out, that stigma is very much prevalent. Ki pata nahi, in case I mention about mental health conditions, then maybe I may be considered as incapable. Then another thing can be job insecurity, that kal ko agar kisi ko pata chal jaya, I might lose my job. That again is a reason why they don't try to address or speak about mental health. So psychological effects are there, but most of the diseases which I see around are stress-induced diseases. So stress is a major reason behind all of this, and stress ka psychological effects can be depression, it is anxiety. We so often see that depression is one of the major causes of, major effects of stress in the workplace. So that's what I had to share.
Let's ask Dr. Duggal about the
Dr.
psychological
Duggal,
impact of the difficulties.
Oh, thank you, Dr. Shima. I think just to sort of add a little bit of context, when we're looking at mental health, we're looking at both well-being and distress. So these days there's a lot of focus on employee well-being. So what are we doing to promote that? And then of course, if employees are experiencing distress, whether it's due to burnout or whatever, or if there is a mental health concern or condition, how do we support them? And I think this holistic approach is something which needs to be brought to focus. And the important thing for us to think of is, why are we looking at it in a workplace context? Why is workplace an important context for promoting well-being for employees, and therefore providing support as well? Because workplaces as systems have certain responsibilities and certain accountability to be able to do both of these things. And I just want to highlight two things. That one is this whole idea of well-being being linked to productivity, like we said. That if you're not coming to work, then it's going to be a loss for the company. But people are now saying that well-being has to be looked after for the purpose of the well-being of the employee, and not as an indicator of whether they are being productive or whether they are doing what they are supposed to be doing, which becomes a bit of a output-related approach. And the other is a systems approach. Usually it has been a very individual-focused approach, which is to say, if someone has a problem, then you fix the person. Because they are not able to cope, then they need to have the resources and they need to take care of themselves, and they need to be able to do what is needed. Two, saying that there are systems that need to be equipped to promote the well-being of the person, and to ensure that if there are risk factors in the organizations, through policies and programs, they are responsive. And just the way a workplace is a context for developing self-esteem, self-efficacy, having a sense of purpose and meaning, similarly it can also lead to burnout and distress. And then even if someone has a neurodevelopmental concern or a mental health condition, can the workplace support them and be affirmative in their action? So just wanted to put that perspective forward as well.
Yes. Please, Dr. Mahanta, could you please add to...
Yeah, I absolutely agree. In fact, one of the most important, I would say, factors which has led to this workplace-related issues, I feel, is workplace mistreatment. We have to talk about that. And when I say workplace mistreatment, here I mention various kinds of mistreatment. It's not necessarily only verbal abuse. It can be physical violence. It can be workplace harassment, discrimination, bullying at work, intimidation. So all of these largely go unreported. So that's why I agree with you, Dr. Duggal, when you say that there has to be policies at place, and these policies need to be very strict, and it should be implemented properly.
Also, I would want to ask Dr. Anjali, because she's been working with corporate and corporate people. So how does it affect the organization, if you could add to this?
So if you positively work towards wellness as well as taking care of people when they are not well, I think it goes a long way. Not only from the humanitarian way, but when people truly feel supported, they are going to support you even if you start sinking. Right? So but if a person does not feel supported, they'll be there till they get their next job.
Organizations need to, I feel the organizations need to make the employees feel valued, feel supported, and feel understood. And that will go a long way in the workplace well-being scenario, I think. Yeah.
I think I'd like to add a few words, especially coming from a space of margins. It's very important to also understand that when we're talking about workspaces, we also need to talk about what kind of a safe space we're creating for intersectionality. We are creating for people coming from different margins, whether it's religion, whether it's caste, whether it's gender, sexuality, somebody who's neurodiverse in nature. How are we creating affirming spaces within these workspaces? I think we mentioned EAPs, and we spoke a lot about employee assistance programs. Something I usually like to ask people is that, how LGBTQ affirming are these EAPs? Very important to ask your own providers, because if we want to create a safer space for queer folks, we need to make sure that they are also able to support queer folks in whatever capacity, whether it is to support their well-being, different forms of initiatives. So I think it's very important that we understand what it means to offer the kind of care and the professionalism that comes along with it when we're trying to bring in these different aspects. Another very important aspect I think to talk about also is, we're talking a lot about, I think in the previous panel we spoke about ADHD, we spoke about neurodiversity. Also a lot more conversation has been coming around neurodiverse affirming workspaces. What does that mean? It means that how lit is a particular place for a particular person, how are they feeling, what kind of accommodations are we offering to our employees, are we understanding flexibility in terms of a hybrid work solution, for example. COVID-19 taught us that okay, people can work from home, but we're still hell-bent, no, you have to go into work. But if it's going to support somebody and they're going to work better, then हमें उसमें क्या problem है? So I think it's so important to understand that if you want to work with an employee, you need to understand their requirements, their needs, and supporting each other better for better results, for better productivity or whatever we're looking at.
Yeah, Richa has been working with diverse population. That's why she could tell us more about that. Thank you so much, Richa. Yeah. Yes,
Work
please.
from home, just one line I would like
Yeah,
to
yeah, please.
I've seen a lot of patients whose work life, that border has been completely crossed during the work from home thing. I mean, the baby, the interpersonal
Yeah.
borders, and the isolation
Yeah,
in
correct,
that
correct.
room,
So,
and
yeah,
and
it had its share of
Yeah, yeah.
disadvantages also. Yeah,
it's,
that's right.
it's tremendous. म्हणजे,
Correct. Yeah.
people have
So
stopped going out.
We have seen as a Deloitte 2022 report about mental health says that 80% of the people suffered, say throughout, 80% had mental health challenges, and out of those 29% of the people, say still were, say taken and off, they had
Yeah.
taken and off, and 20% had resigned, and 33% were still working in those conditions.
I
That's
don't know
alarming. That's
sorry.
really, really alarming.
I don't know about the statistics, but the chunk of people I have seen
Yeah,
in my private practice, people have stopped going out altogether.
correct. That's right.
I mean,
So
their
let's-
health has decreased, no physical exercise.
Yeah,
that
correct.
d-
So that's why,
gut brain problem, like
That's
people have mentioned here.
correct.
Absolutely, they are just becoming robots.
Yeah, that's right. So because I said that this would be a solution-focused panel discussion, let's do some exercises to understand what can people do while sitting on the chair in offices. Let's do an activity. Okay, we've been doing it, so we all must have done it when we were children, when we were in school, but we never realized that these were so important. Let's start doing it then. We'll spend some 2 minutes on that. So can we do this? Yeah? This is such a wonderful activity. And it has now, these activities are for both hemispheres to work together. So they stimulate both hemispheres, these activities. Now this one. Like this. Okay. This. Can you all do this? Yeah? Interesting? Yeah? Again, this. So 30 seconds of this exercise while you're sitting on your chair in your office. Actually, yes. So this one. Yeah? Yes. So back, all of you are here now? Okay. Yes. So coming to the second part of our discussion. So we'll understand.
Dr. Shiba, I just wanted to add on to what she has said.
Yes, please.
One of my research scholars, actually, she carried out a project,
Yeah.
regarding mental health at workplace for the LGBTQ community.
Yeah.
And there she noticed it was basically a quantitative as well as a qualitative study.
Okay.
So there were focus group discussions, there were interviews, and she saw in the results that they were actually suffering from workplace mistreatment to a great extent. Whether it was workplace harassment or there were discrimination, there were name calling, ridiculing, bullying at work. So, and majority of them were actually suffering from depression and anxiety issues. All, otherwise also in their families, in the society, they suffer from prejudice and discrimination. So, and in the workplace also this is happening. And somewhere I feel, as rightly pointed out by our fellow panelist, that, besides having strict policies at place, we need to be empathetic towards them.
Yeah.
We need to, give open spaces to talk about these issues. Most of the time we don't discuss about these issues. We feel uncomfortable and keep it underneath the carpet. So somewhere I feel this will go a long way and in carrying out, proper awareness.
So I would like to ask Dr. Duggal. So Dr. Duggal, what can employees do if they suffer from any mental health condition? Say slightest would be very mild anxiety or mild depression. What can people do themselves to help themselves?
Yeah, so one is, of course, we often talk about self-care and putting in some sort of creating spaces. But I think one thing that we know is that connection is something which is very fundamental need for us, and figuring out who are in their support network, who they can reach out to for immediate support. And of course, the other thing that I want to talk about here is also about awareness, so that if we have a little bit more awareness of when we perhaps are experiencing distress and there is a time to access support, being able to also do that. Awareness not just about like mental health concerns, but also about recognizing what are the factors or in my environment that could be contributing to high distress, and also being able to advocate for some of those rights themselves. So, otherwise it becomes more about like just self-regulate and take care of ourselves, but the burden is not ours alone. Some of it can be taken care of in relational spaces, some of it can be taken care of in team and peer spaces, and some of it, of course, through systems change. And I'll come back to that if we get another chance.
Yes. So Dr. Anjali, please put some light on this, Ken. What can people do to help themselves?
I think companies should include mental health checkups regularly in there, just as we have physical health checkups. Okay, it's very important. Mental health cannot get a second place now. Because if today somebody is, of course, a lot is being done in the wellness space, but to recognize that there are mental health disorders, because 1 out of 7 people in India is suffering from a recognizable mental health condition. So we should not just leave it. We must have mental health professionals on our panels, and we must conduct surveys, tests, because slowly but surely the suicide rate in our country is galloping. And we cannot say that, oh, it's just happened by chance. We cannot, one employee dies by suicide and there's a big noise. All the newspapers carry it. After a few days, the news dies.
Correct.
Only to come up again. I think we need to have very, very strong policies, and we need to start implementing them.
So true. So true. Yes, please.
I think taking from what Dr. Anjali just shared, it's also important to protect the rights of somebody with mental health conditions, issues, because I think there's always this fear that if I talk about my mental health issues at the workspace, then my job will be taken away, right? Job insecurity, somebody mentioned as well. Why should I talk about my issues at work? Because they are not going to let me keep my job. Small mistakes I make, they'll be like, हाँ ये तुम्हारे mental health के वजह से है. And that fear is something that's very real. So I think awareness is so important to then also talk about like quick mental health check-ins. I remember we did these trainings with...
So, Richa, we'll be talking about that also. So what can organizations do about it? But how can people help themselves if they are in that situation? You know, if they are suffering from depression or anxiety.
I think to support your own self, as Dr. Anjali also said, to seek support whenever necessary, to go to a therapist. These are things that we talk about again, but in a country, हमारे country में हम ये नहीं करते. These are not things that we do. Even if I have to ask a quick question here, how many people to go to therapy? Not too many hands will go up. Like that is the state of where we are right now. There's a lot of taboo in even seeking out for support, because vulnerability does not come to us easily. It's very difficult to be vulnerable in front of people. So I think accepting and like dealing with your own vulnerability is also a good place to start.
Please add to what can people do to help themselves.
In order to help oneself at an individual level, I feel that it's important to make some lifestyle changes, which one of the panelists had mentioned before. And be it eating healthy, balanced diet. Nowadays, young girls, they want to go for crash diets. And as a result of which, what happens, you know, the essential nutrients, whether you talk about carbohydrates, proteins, and vitamins, minerals, they're not getting in proper quantity. And as a result of which also depression is related to that, you know. And besides that, sleep hygiene is very important. One has to follow that. And yes, relaxation exercise, relaxation techniques, like you have yoga and meditation, then we have breathing exercises and engaging in hobbies. All of these go a long way. And besides that, you had mentioned about seeking support, forming meaningful connections, not just having 5,000 friends on Facebook or Instagram, but having few good friends with whom you can discuss, talk about your vulnerabilities, feel comfortable, feel supported. I think that will go a long way. Yeah.
Yeah.
If I
Yes, please.
What I see as a major obstruction and hindrance in getting the proper care is, one, the individual themselves don't realize it pretty early that they are struggling with something. They take it as a day-to-day routine life, maybe tough life, maybe the challenges. Subsequently, it takes a toll on their productivity, health, and everything. So we need to have more education and awareness so that individuals themselves recognize that they are struggling or going through something. Only when they will understand and recognize, then only they can seek help, they can make changes, they can have the support group. Together we can make other people aware of these things, so that when anybody is showing any sign of change in the behavior, the subtle signs, others can read it. Because for individual to read those signs are really, really difficult, because in mental illness what we lose early is insight.
Also, people don't know about medicine, like Dr. Anjali is pointing out. Please.
The importance of taking medication. Gone are the days that psychiatrists gave sleeping pills or pills to make you addicted. We also need to understand that we don't need everybody's opinions. Right from the chemist who will say, "Ye dawai kyun kha rahe ho?" to maybe your family doctor who will say, "Go for a holiday." I think we need to understand that today, just as we will not stop anybody's blood pressure or diabetes medicines or chemotherapy, we will not stop their psychiatric medication. You have a problem, you have a side effect, go meet the doctor, talk to him or her about it.
So there is a popular misconception that once you go to the psychiatrist, he'll start with the medication right away. So that is not the case. We assess, and we assess the whether it is mild, moderate, severe. We assess the situation, and then we decide whether to give medications. Okay, so that is the thing. Then about the medications have evolved over the last 10 to 20 years. Okay, the medications which your your parents or their parents may have received, or your uncle or their fathers, great grandfathers may have received, are completely different, and now they are banned or not used. Okay, so medicines are being completely overhauled, and now about the medicines and the side effects. So really these medications have absolutely close to nil side effects.
Yeah.
Okay.
Yeah. Definitely.
Unless
Yes.
the illness
Any
is
suggestions from audience? Yes. Yes, please.
So I have something to ask you, sir. Since you are saying that medications are not straight away given to the patients or whoever is coming. Now, during my career, what I have seen, if I have seen 100 patients, out of them 85 were outrightly prescribed medications when they were not even needing those. Let's put it this way. How you can change this conception that a combination of psychiatry and psychology or psychotherapy is needed. Sometimes, not to offend you, but this is as per my experience. Psychiatrists themselves feel, you know.
I'll answer your first point.
Okay.
I said depending on severity. If I assess you and if I feel that you have mild to moderate or moderate to severe or severe to very severe illness and you need medications or you are having certain situations for in the recent future, like some maybe exams or some tough situations for which you urgently need some medication, then I might prescribe you. Okay. But if you have mild, extremely mild symptoms, then we don't give it. Or if you have a first episode, very mild symptoms, then we'll not give it.
No, I understand what he's saying.
Yeah, they
he's
can
absolutely right.
yeah.
What I'm saying is, as per my experience, the person comes to him as a psychiatrist, he diagnoses it, and he says कि medication देनी है. The same person comes to me for psychotherapy, I can medication की ज़रूरत ही नहीं थी because it's not severe or any level.
So yeah, so I am trained in medicine.
मैं पूछ रहा हूँ कि medicine देनी ही ज़रूरी है.
Look. You are completely misunderstanding the situation. I am a psychiatrist. I will assess and give you the option whether this condition requires medication. This condition can be treated with medication or can be treated with therapy. But this will take a longer time. Medications will take lesser time. Okay, I can give you two options. But if your illness is moderate to severe, then I'll say first you will require medications. You're not मतलब तुम साइकेट्रिस्ट और साइकोलॉजिस्ट में डिफरेंस कर रहे हो. साइकेट्रिस्ट इज MBBS MD. They are born to prescribe medications. Psychologists born मतलब they are trained to prescribe medications. Sorry.
One minute. I'll tell you. So I work at our center. We have 8 psychologists and 2 psychiatrists. Okay, the best is to work together. Okay, in collaboration. And how that helps is because your condition, your disorder may require medication. Your personality may require therapy. So when you work together, you can look at all aspects and you also have a feedback from each other. Okay, and that really helps. So to all my psychologist friends over here is that, you know what happens is, suppose somebody has come to him with a suicidal depression, he has given medication, the person is feeling better, 5 other people are saying, abhi tum psychologist ke paas jao. But if the psychologist says, dawai mat khao, the patient gets confused. And I think we need to work together so that we can help more and more people.
Very well put, Dr. Anjali. Yes, please. You have some questions.
Okay, so how would medication help an ADHD child, severe ADHD? That's
because even I'll just add to this question only, because most of the times the medicines make them so very sleepy and they are so drowsy and lethargic in the school time.
See, when we are talking about ADHD, it's a neurodevelopmental disorder. When it's a disorder that the brain is not working or functioning as per maybe the normal counterpart of the child. So in that case, we need to evaluate the child very nicely, what kind and what stages he is into. There are some subsets which are more in attention deficit. There are subsets which are more in hyperkinetic problems. Not that every child has to be prescribed medicines the moment they are diagnosed with ADHD. There are a lot of therapies, a lot of work with the parents. We need to educate them to deal with the child, how to reduce the stimulation of their brain, how to stimulate and focus on one particular part. And then along with medications are prescribed to help them achieve their goals, to help them streamline with the developmental stage they are going through. And most of the stimulants which we prescribe for ADHD, they are not sleep medicines. These medicines help the child focus and be attentive during their lectures, during their tasks. So
So there are some disorders where primary treatment is medicine. There are some disorders where primary treatment is psychotherapy. Milder conditions can be treated with psychotherapy, but say I always say that when both medicine and psychotherapy are the treatments, when they both work together, that's the best treatment, when they work together. Yes.
So if I have a child who is coming to me for his 10th standard exams, and if he is not able to achieve his full potential because of fear of medication, I will counsel the parents, give him medication so that he can achieve. Because if he does not achieve, he is going to go all over the place. And tomorrow he may not be taking my medicines, but he'll be taking drugs and he'll go down that route. So we have to assess, and that's when we have to see. Ma'am, to answer your question about if a patient is coming to you who is drowsy, okay, I would say just call up the doctor and say, this patient is looking very drowsy. Can we do something about it? But tomorrow if you tell them, dawai band kar do, and that person jumps off the 25th floor, will you be able to sleep at night?
That's right. Medicine band kar do to hum bol hi nahi sakte. Psychologists cannot. We are not medical people. We don't know कब start करनी है, कब कम करनी है, कब बंद करनी है. हम नहीं कह सकते. You have to go back to your psychiatrist to understand about your medicine. We have very less time.
Sorry.
I'm really, really sorry.
Sorry. एक last point में.
Can we have a question from her?
I don't have a question. I just have a suggestion. As we were discussing, the route got little diverted. Like, what can we do as a solution for the workspace? So in schools, we keep students busy. Their reading habit is going on. So we alarm as dear, drop everything and read. That way we can start in the workplace also. Okay, drop everything and meditate. At least for 5 minutes to just calm down. Even after the lunch, especially because, yeah. Because after lunch, everybody start feeling little low. So at that time, if they meditate, also they can perform well on the next working hour. Thank you. That's only the thing I want to add.
Okay, so please, sir, can we have your question? Yeah. So because we wanted to come to what can organizations do? Yes. Yeah. Yes. Definitely. Yes. Yeah. So that's what we did, no? The exercise which I helped other people. Yes. Definitely it helps. Definitely. What can organizations do to help their employees, to make their organizations better place for their employees to be in? Please.
Encourage communication which is open, clear, and in a way to help each other and to help the organization.
Do mental health checks with your employees. If you notice somebody is quiet, you can just ask them, how are things, what's happening. क्योंकि again COVID-19 के समय हमें नहीं पता है कि लोगों के घर में क्या चल रहा है. Domestic violence is happening. We knew so many statistics. So like literally just check in with people, ask people how they're doing. That's as simple as it can get.
I feel somewhere that stress audit, time to time stress audit is very, very important. Just like we do financial audit, at the end of every fiscal year. Same way, in order to identify the stressors, what are the characteristics of the individuals who are suffering from stress. So stress auditing can go a long way besides that mental health awareness. And one more thing for workplace bullying I have to mention, since I spoke about that, there is an intervention model which is called as RESPECT model. It's an acronym. R stands for recognition of the workplace bullying. E is for your education, educating the people. S, support. Support is so important, providing necessary support to the victims of bullying. P is to have anti-bullying policies in place. Again, E is to, I mentioned about education, what is left, it's empowering employees to speak up. And whenever they see somebody getting bullied, then you have C, that is open communication, which ma'am had mentioned a little while back. So open communication is the key. And lastly is T, that is training the individuals. Training is very, very important. Training about the policies and practices in the workplace. Training them about what not to tolerate and how to report when they see anything getting wrong. Okay, thank you.
Organizations, the good thing they can do is they create a space, they create an atmosphere where anybody who's struggling with any mental health condition can come up and talk, accept and acknowledge it without fear of losing their dignity, maybe prestige, position, or maybe job. This is one thing, and apart from that, when these things will be acknowledged, space will be created for communication, and in that many things will be solved for one person and more persons will come up and talk about it. That way we can create a healthy atmosphere in organizations which acknowledges the mental impact of their employees, and also resources, where to go and deal with it. The resources has to be available. Maybe on their panel, they can impanel people. I work with a lot of corporate office who are association impanels, where they can go and talk, and these things can be dealt with easily. Thank you.
Yeah, no, I think this is a long list if we had a wish list, but I'll focus on 5 things which I was thinking we can think about. And I think one thing is that it has to flow from the leadership. The leadership has to have a vision to create organizations as communities of care. It is not tokenistic. It is not like, something which is very individualistic. So 5 things. One is structure and boundaries. I think all of us have spoken about that. Organizations need to think of work-life balance. Create time for physical activity. If people are working long hours, it's not going to happen. 2, certainty. I feel one of the things is unpredictability, job loss. Uncertainty creates a lot of concerns for young people particularly, so career pathways, mentorship for that. And then safety. I think safety for anybody who is, in the margins, or like Richa was pointing out, taking an intersectional lens, having proper policies and grievance redressal mechanisms, because power is a real thing. If I have an issue with someone who is in power, I will not be able to articulate it. So safety. Connection, people look for connection in workplaces. Loneliness, isolation, feeling victimized can be very, very sort of disempowering. So whether it's mentorship or peer support, we know that the first person someone talks to in their workplace is their colleague, somebody on their team if they are in distress. So enabling people to be able to support each other. Finally, I think, for leaders to also lead by example. There are real issues. People, if, not given support timely, we know about burnout, we know about use of substances, we know about digital use, we've been talking about eating issues. There is a whole variety of sequelae that can happen. But I think really thinking from a very promotive perspective, a preventive perspective, and then of course having services and EAP programs, but not absolving ourselves by only saying, oh, there is an EAP and you can access if you need, because not everyone will be able to even seek help. Like we are saying that there are many other things that might come in the way of that. So thinking more holistically.
I don't think if you have heard this, but anonymous questionnaires, if anyone uses anonymous questionnaires by the organizations, and not just not regularly, but randomly.
Yeah.
I mean,
how would anonymous questionnaires help?
So so usually these scales and
Right.
these mental health scales and all
Right.
these use some or the other form of identification, like class 1 employee, class 2 employee, class 3 or class 4,
Yeah.
some or the other sort of.
Right.
So somehow people are know that somewhere information is going to get leaked. And even today, authorities discriminate based on mental health.
Yeah, but then
Even if we talk here about all this, that no, mental health should be normalized and all
it
this,
will take some time to
but still the reality is that
normalize this. Yes.
people, authorities hire, committee, that general manager board and all that board of companies, they do discriminate. The fact of the
Yes,
matter.
please.
So,
Having worked in the mental health field for last 4 decades, in the beginning, when I worked as an employee, the best thing which I still remember as a employee, my director, she used to call every staff member once a month to her office to not only look at what the work is being done, but also ask about the family and about the health. That was every month. There used to be a fixed time. And second thing there, which I learned, which I still practice, is negative feedback to the employee alone and positive feedback in front of the other staff. That's true. And secondly, as a mental health professional, I don't know how everybody feels, our attitude towards a person suffering from mental illness is still, especially if a mental health professional is having a problem. If in a big organization, my employee has a mental health problem, how I will handle his situation? If he is asking for leave, if he needs admission, if it's a major mental illness, how our attitude will be, I think we need to look back and think and change ourselves. Yes.
Yeah, definitely. Thank you so much.
thank you, sir.
Thank you. I think we are out of time. Otherwise, we would have invited more questions. So the simple takeaways are mental health checkups, like Dr. Anjali said, eat, sleep well, and physical exercise and therapy. Most importantly, go for therapy. That's very important. Just break the stigma. Go for therapy. Go for medication if there is a need. Go to a mental health professional. That's I think, the major takeaway from today's discussion.
I would just like to add, I'm sorry I am
Yes, please.
interrupting you.
No, that's okay. Yeah.
I would like
Please.
to use this platform to just communicate one message. Mental, psychological disorders are basically fractures to the mind. And just like physical, they are just like physical fractures, but they can't be seen, basically. Unlike physical fractures, these fractures take a lot of time to form. And now our topic is workplace mental health. So even in the workplace, they take a lot of time to form. And we just carry on walking on those fractures and deepening those fractures because we are not aware that they are fractures. So just like physical fractures, but in the end, they end up just as severe as a physical fractures.
True that.
And
Yeah, sure.
Secondly, they start paining like physical fractures, more than physical fractures, basically. The only thing is that we can diagnose physical fractures on X-rays, MRIs, and get timely treatment. And what treatment do we get? First, we get the medications. First, we get plaster. Okay. So we don't object for that.
Correct.
We object for medications for this,
Yes.
which is even more painful. Just because we don't have any
Symptom. Yeah. So it's
symptoms,
abstract.
we don't have
It's
any test.
abstract.
We don't have any
It's
test,
abstract, yes.
basically.
So guys, thank you
So-
so much for hearing us.
Just one
Uh,
sentence,
yes,
one sentence.
please. Yeah.
So,
Sorry.
so I would suggest, so for these fractures, the template is same. First take the medicines, let the fracture join, then take the physiotherapy. Here the template is the same. Take the medicine, let the fracture heal, and then take the psychotherapy. So, but unfortunately,
I would not agree with that. I would not agree with that.
but
No.
yes, not all. For
No.
for minor tears,
yes.
for minor tears or minor sprains, we don't take medicines. We just take physiotherapy. So for minor,
I would
so for
only
minor
say,
fractures,
I would only say the best treatment is psychotherapy plus medicine. That's the best treatment, right?
Huh.
That's the best medicine.
basically it is a
Right?
fracture or a tear or a sprain of the brain.
Thank you so much, guys, for listening to us. And I wanted to have. Yes, I wanted to have resources. So, guys, I wanted to have resources from our panelists. This was a power-packed panelist group. But I would want you to individually connect with them and have resources. We are out of time now. Thank you so much all for listening to us. Thank you. And thank you so much to the panelists for wonderful